Hello, everyone. Today we have this event co-hosted by RUSA LGBT, and Violette will talk a little more about the organization. I will present the project. Migrant Hub will talk very briefly what we do. We are an organization led by women, mostly from forced migrant backgrounds, and we're also a collection of academics and social work students. We're based in Fordham University, but our core group consists of women from different countries who lead this participatory project. So what we do, we collect resources and support each other, and also educate the public about the issues that women face, the women who come from forced migration backgrounds. We have most of our participants are asylum seekers, some of them undocumented women, and some of them in different immigration statuses, but most of them are facing all types of challenges related to non-permanent migration status. And as I said, majority are asylum seekers, asylum-seeking women. We have women, most of our core group, they speak Spanish, French, Russian, and some indigenous languages as well. So today I'm here on behalf of our project directors also, Marciana Popescu and Dana Alonso, they lead this project, and it's funded by Mother Cabrini Health Foundation. And this is it. So we do not focus specifically on LGBT plus Q issues, because we kind of work with any women and women identifying immigrants. And today, because of a Pride, we want to celebrate Pride. So we had a series of events and talks dedicated to the Pride Month and to highlight specific issues and health equity and access resources, challenges and solutions for women who identify as trans women, as lesbian, bisexual, and non-binary women. So thank you for agreeing to join us, Violet and Alex. And Violet is our co-host today. Can you talk a little bit what RUSA is and RUSA does?
Of course, yes. Thank you for inviting us to this event. My name is Violet. I use them pronouns. I represent the Russian-speaking LGBT community that is called RUSA LGBTQ+. We are a community organization that provides different services for Russian-speaking LGBT, asylum seekers, immigrants, refugees. We have people from all the post-Soviet Union countries. We provide referrals for social services, for legal support, and we also organize different events where our community members can participate, get involved, and enjoy the sense of community. And I will pass it to Alex.
Thank you so much, Bill. Appreciate it. My name is Alex Trifonov, and I use he, him pronouns. And I'm a community health worker and patient navigator at the Panelists Cancer Center of Langone Health System here in New York City. So the scope of my work is I work with oncology patient navigation. So basically, I navigate patients through the cancer continuum, and mostly I focus on the cancer prevention screening. And as well as I work with the LGBTQ plus health initiative and on different projects, and including the LGBTQ plus immigrants. Us and RUSA, we definitely work together. So I do have a lot of patients from the RUSA LGBTQ plus, and I navigate them to get established care here and in the United States. To establish care with a doctor, specialist, depending on the need, for preventative services and screening services. So yeah, as well as I do outreach to the community, including LGBTQ plus community. And I also am a co-chair of the Panelists Cancer Center LGBTQ plus staff task force, which is just newly formed in May. So that's a big success for us, and yeah, that's what my scope of practice is.
So Alex, and also Violet can jump in. when needed. So for our community, as I said, we do not focus specifically on LGBTQ plus communities, but we want to educate our immigrant communities and also our social workers about specific health equity issues, rather health inequity. So what women who identify as LGBTQ plus have to know in terms of health equity in New York City specifically, what you can share with us?
Yes, absolutely. Women identify themselves, I just want to say one thing that, as everyone should know, that sexual orientation, gender identity is, two separate terms, right? Even, and using your pronouns is, it's all different terminology, right? So we don't want to put anyone under one umbrella term or use any pronouns, assuming that, for example, someone has those pronouns by looking at a name, for example, right? So my personal approach to work with LGBTQ plus immigrants, and not only immigrants, and women and men and people who identify themselves as non-binary and etc. I don't assume, right? We cannot make any assumptions. I always ask, people, my patients, straightforwardly, like, what pronouns would you like to use? How do you identify yourself? What is your gender identity? And what is your sexual orientation? The reason I'm asking those questions is because I need to know how to navigate the patient, right? And the more I know about the patient, not only health-wise, but also social-wise, right? How does person express themselves to the world, right? This is the most important thing, which can affect health and patient care, right? So, we don't assume, right? I ask and make sure to make sure that I document and know myself, and all the clinicians know how this patient express themselves, right? Another thing is to be very direct, right? Definitely explain to the patient, what to expect, right? If I personally, I'm figuring it out as I gain my experience, right? I obviously came to this job from different multi-specialty medical clinical fields where I tried before, but I gain my experience as I go, and I always tell my patient, tell your provider who you are, and make sure so we can make sure how to treat you, right? I know it's a very broad topic, and I may be sidetracked a little bit, so feel free to put me back on track because I'm very passionate about the topic. So and I really love what I do. So definitely. But yeah, so number one thing is we don't assume, right? We ask all the questions, and number two, I want patient to feel comfortable with their provider, right? So I want them to, if I don't know what they need to expect, then I tell them, listen, I don't know, but this is the examples what you can experience, right? I want to prepare my patient as much as possible. If I need to find, for example, for LGBTQ plus community, we need to make sure the provider is LGBTQ plus proficient, right? And if, for example, I have 5 providers on the list in a certain specialty, and the patient has somewhat urgent case, right? And I have to send a patient to a different provider. Well, I'm not sure if LGBTQ proficient or not. I tell patients straight away, listen, I don't know what to expect. I'll support you through the way, and I make sure I make the office aware and the clinician aware on patient situation. But honestly, I don't know what to expect. So straightforwardness, right? No assumptions, straightforwardness, and also explain to the patient the basics of the U.S. healthcare, right? Is to make sure that if, what's the insurance status, right? Unfortunately, or I don't know, fortunately, I think it's more fortunate that we have to care if the patient's insured or not, right? The rate of uninsured patients in New York City is high, but also there's multiple resources available for patients, in order to seek insurance or get care covered being uninsured, right? So be aware of your resources. And I always share resources with my patients one way or another, and try to, even if I don't know something, I always research and test it out. So that's kind of like a little introduction. So let me know if you want to, kind of like dig deeper somewhere.
Looking at the health inequity, I heard you talking at previous events, specific diagnoses are more prevalent, right, among certain groups of LGBT plus populations. And if you look at the women identifying people, right, so there's like specific diagnoses. If you remember, what were those, and why it happens that there is this certain like health inequality, right? That why certain groups experience higher prevalence of certain diagnoses. You mentioned certain cancers and other diseases, and then you connected also the issue of access, right? The preventive care and others. So if you can talk a little bit about this.
Sure, absolutely. I'm kind of going to break down and I think 3 main categories, right? I'm gonna talk first of all. Let's start with lesbian or gay women, right? I think the most important thing for any woman to know, right, is that of any category is that cancer prevention is really important, right? Early detection saves lives. I keep saying it to any of my patients all the time. And I'm making sure that they're aware what cancer screenings are available, right? So for lesbian women, for example, is the rate for breast cancer, for example, or cervical cancer is much higher, right? Why? Because statistically, lesbian women tend to go for those kind of screenings, in a much less percentage than straight women, for example, right? So this is something to be aware about, right? Which kind of brings us to transgender women, right? That you always have to be aware what organs do you have, right? It's it just physiologically and health-wise is very important, right? So, and for example, at our organization, and I think in most health organizations, we use the organ-based approach, right? It depends. So there's organ which needs to be screened for example, for cancer, right? If you, for example, someone who has breasts, right, you need to make sure you screen for breast cancer. For someone who has prostate, then you need to make sure that you check for prostate cancer, right? So always use the organ-based approach in all categories. So women, right? We're not. I'm gonna be kind of like going more general here again, but you have to make sure that you do that and you aware and make your clinician aware, right? Or the people who work with you medically, that what organs do you have, right? Rates tend to be even higher for cervical cancer and breast cancer for even non-binary women, right? I mean, people non-binary, right? I should say in the non-binary category, because again, people tend to forget to screen certain organs in the body, right? So make sure you're aware of the organ-based approach and what cancer screenings are available. So kind of the kind of approach which we use.
So still, you started talking that there are a lot of initiatives and you're joining, there's a new task force with providers. But still we know that the issues of access and sensitive care and appropriate care for non-binary people in general, LGBT plus people and women specifically, is a problem, even in such a place as New York, right? So but why this problem exists? I mean, don't we have, is any physician and any specialist not supposed to be trained in treating those populations, to treat everybody equally? So why we still here, and maybe Violet can also confirm, and from your experience working with clients, why people still afraid, why people still trying to find the clinician and exchange this information. Oh, this, you have to go to this clinician, not to that clinician, you know, because people are scared, right? So what are all the goals of your initiatives, and how to make it more equitable for everyone?
Absolutely. We have one of the initiatives I have not mentioned here in this panel yet, which Violet is actually aware about, and I hope they will be joining us. Definitely. It's called Perelman Cancer Center LGBTQ plus Patient and Family Advisory Council, right? So this is the opportunity for, not, we call it an under Perelman Cancer Center, but it's obviously not only about cancer. We want to expand it, you know, in the whole system. So what do we actually do? We invite patients and their families to talk about those issues, right? To talk, this is the opportunity for them to meet those directors, those clinicians, and the people like me, the community health workers who work directly with the community, and to make us personally aware about a situation, like individual situation happening, right? Because, you know, it's clearly impossible. Yes, we do have statistics, right? It's clearly impossible to see the big picture without getting feedback, right? Sure, the statistics are numbers. We know the numbers. We know the numbers are low. We know the numbers are, you know, whatever, the certain way they're presented. But we need to know the feedback. We need to know the feedback from literally people and their families, right? So that's why we have the PFAC. So we invite people and we talk about their experiences, right? I know it's you know, not a lot of experiences we hear about, but those feedbacks are definitely imperative. They made some difference already, and I'm sure. I mean, I hope that our organization, LGBT Initiative, kind of like expands a little more, so we can definitely have more navigators like me who can definitely, you know, work more with LGBTQ plus people and immigrants, and you know, because like personally, I'm gonna tell you. This probably definitely exists, right? And I definitely had a lot of patients who encountered one or more situations, unfortunately, and in any healthcare facility, not only in our system, anywhere else, right? We have to be all LGBTQ plus proficient, right? But unfortunately, you know, we're working in that, right? We're working in that, and our system is pretty proficient, right? I mean, that's why we have the LGBTQ plus health council, you know, to kind of provide education and training to physicians, nurses, their staff, and you know, but it's a big job. It's a big job, and unfortunately, the problem, you know, still there. But we are definitely making steps and making a better world for all of us. And equity-wise, I really hope that people do use the resources they have available, because like resources like us, for example, we can definitely send people in the right direction, right? So, you know, where they can get their care and the care and proficient care, right? The most important thing. So, yeah, I don't know if that's answered the questions. Violet, if you want to chip in.
Yes. I actually wanted to talk a little bit from the experience that our community has, that people who come to us are experiencing. So in terms of immigrants and immigrant women and identifying as a LGBT, I have to say that many of these people who are coming to this country, many of them do not speak the language, and many of them, the first location where they end up being is the Russian-speaking community of New York, which is, I would say, not the most open-minded yet in terms of the LGBT proficiency, in terms of being informed who these people are. And even the medical professionals, unfortunately, either based on their prejudices or just being uninformed, they can potentially, you know, harm the mental health, I would say, of people who are turning to them for help. and they turn to them for help just for the lack of knowing, having the information about other clinics, other professionals, and for the lack of the language, because whom they are going to turn to? Of course, people who speak the language, right? To explain what's going on with them, even though that many clinics have the translation options, still some of the people would be hesitant to discuss some of the questions, knowing that there is someone else in the room. So I wanted to say that we are actually very, very lucky to have Alex in our community, to have him as a medical support coordinator for our folks, because I should say that these kind of experiences related to health issues can be very anxiety triggering, very trauma triggering, very dysphoria triggering. So Alex, we're lucky to have Alex as a person who is inside the health system, and he can advise who is the best person to turn to for this specific person. So our approach is kind of very individualized. We want to hear who this person is, what are their concerns, not only in terms of the health issues, but also in terms of being comfortable talking to the medical professional. So yeah, these are the experiences we have. And yeah, I think we have to keep in mind that everybody is different, and we want to help everybody despite whatever it is, the health issue or the background.
Thank you so much for your kind words, Violette. I appreciate it. I'm definitely to help.
Oh, so my question connected to that. So you mentioned language access and like the cultural issues, and especially for new immigrants. So we talked about the Russian-speaking community, which is very diverse in by itself, right? People come from all the different countries and different cultures. But what about other patient navigators? Do you have people with other languages, and do you have actually a network of people like you across hospitals, or how this work? Like how new immigrants can find you, and what languages do you speak?
Yeah, yes, I totally agree. That's a big question where the language access comes to play, right? So first of all, I want to let everyone know there's a law, federal law, state law, in all United States that you can get a medical interpreter, right? First of all, I know sometimes people in other languages, not just Russian, in other languages, they don't like medical interpreters, right? Because they're not sometimes culturally competent, right? Especially, I don't think so for Russian it works. That's kind of like that, and it's in broad aspect. But for example, for Arabic, for Chinese, right? For any other languages like that, when they have this one language and the multiple cultures within the language, right? This is something very very touchy subject, right? So in our system, I mean, I'm the one who really works with the LGBTQ plus immigrants. I have a colleague who and friend. So she's Arabic speaking, and she also does work with the LGBTQ plus immigrants, and she's very proficient. She comes from the very interesting background. From Morocco to Egypt, she's kind of like this mix, knowing all this different cultures, and sometimes I even ask her like, what is this last name coming from what country of or Arabic speaking country, and she tells me right away, right? So this is, you know, someone else's culture competent as well. We do have another two community health workers who does one who speaks Spanish, another one who speaks Chinese. However, they're not really involved with the LGBTQ plus community. So but we definitely, this is something we keep telling our higher ups and directors that this is something we have to do. Maybe, you know, have them more navigators like me, for example. kind of help the LGBTQ plus immigrants. But I just want to let you know that there's a, LGBTQ plus patient liaison available at Langone, right? So there's an email we can share later with Tanzila, so we can maybe share with everyone. If you need any help at all, just shoot an email, right? I mean, it doesn't have to be perfect, right? If there's no language, I mean, type in any language, I'm sure we will find a way to translate it. Going back to the things that you have to have medical interpreter before you have any appointment with for any medical service. There's a law. And that's what I keep telling my patients. Sometimes, my patient case load is growing, right? So it's not that I can make every single patient's appointment anymore, right? So that's why I keep telling my patients, if there's a primary care visit, regular follow-up, then just ask for an interpreter, right? Just to learn a phrase, I need a Russian interpreter, I need a Chinese interpreter, I need a Spanish interpreter, right? So this is something, we have to make sure that people are aware about, as well as, for example, I'm currently under the training to be certified medical interpreter, which is our program sends us to make sure that we can legally translate for the patients during the appointments, right? So that way we can, when patient goes for an appointment, they can call us, right? And we can translate even over the phone where we are unable to attend the appointment. So there's steps made. We're making some steps. They're surely, but it's steady. But we do make steps. But there are different people, who different from different backgrounds, are also involved in an initiative. But if you speak any other language than the ones I mentioned, then you definitely need to ask for an interpreter. And this is once again, this is the law, and every patient have to have an interpreter if they're not proficient in English, right? So the provider has to provide you an interpreter. At least in our system, it's definitely mandatory, and every single office is definitely, or patient area, I should say, not just the doctor's office, patient area, including the hospital, is equipped to provide an interpreter. So the people have to kind of like be a little more proactive. And I know our immigrants are very shy sometimes, and I definitely get it from experience. I definitely sense it a lot, but I'm trying to help them build that confidence to ask for the service that actually law provides to them.
Yes, it's not only the language. I mean, it's whole different culture, and also people been experiencing lots of oppressions because of their identity. So it's not easy to start trusting the system. So you work for the Langone, which is, I know it's a private hospital system, right? Do you cooperate with the state and city, other providers, including public and other private? Do you have kind of a network of providers? Like, how do you learn about all this feedback? You mentioned that you're looking for feedback, right?
Definitely. I mean, we definitely have some needs assessment, like surveys and everything that we're doing. But besides that, we do have some partnership with different organizations, and also we can navigate outside of the system, right? We can do that. So if the patient prefers not to come to NYU, but prefers to come to Mount Sinai, but still comes to us, finds us, we're still going to go with the patient, whatever patient wants to go for to get the care, right? If we are working for NYU, I mean, we don't have to bring them to NYU, right? We can navigate to whatever patient wants. I mean, that's kind of the way we cooperate as well, right? So we do, the other way we're doing is that the very big one is that we do community outreach, right? That's how I got involved with RUSA LGBTQ plus, because that's how I found them, right? So I kind of went online, and when I just started the job, I kind of went online and started researching very, kind of like researching like crazy, because I really wanted to find all of this community-based organizations and some faith-based organizations, right? Because that's where most immigrant community goes to, right? For example, there's we cooperate with some organizations in Bensonhurst, like JCH Bensonhurst. For example, like Brighton Neighborhood Association, Brighton Beach, this is more like the organization which does like some paperwork for community for free and stuff like that, right? They're like social services basically. And other organizations, right? Some organizations in Queens, like Queens Community House. So we do community outreach, right? We do some events. We do go and survey people. We just finished our cancer needs assessment survey, which was a big survey, which came out with a good data, but we're still working and analyzing the data. So there are ways to communicate, outreach, and provide education to the communities. So, yeah.
Yes, thank you so much. Violet, you want to add anything in terms of network of those providers we can trust? I mean, how I know the RUSA also works on building this kind of network, so you know where to send people and who to recommend.
Right. Right. So I would usually send people either to Colin Lord, which is a clinic specifically focused on LGBT health. And they provide some really great services even for people who do not have insurance. They also help with applying for insurance. But when it comes to something urgent, because there is a wait time for them to become their patient, you are really like have to fill out some form and then make an appointment. They kind of call you in a month or so to make an appointment, become their patient, and like assign you a PCP. When it comes to something more or less urgent, I would definitely refer to Alex and talk to him, tell him a little bit about the person, also in terms of how they feel right now, what is their state of mind, how, like what concerns they are expressing right now. And then we would kind of work around that and see if there's really something urgent and there is no appointment in NYU Langone health system, then Alex and I would make a decision. Okay, maybe we can refer this person to another clinic, just to make sure that they get the best help we can provide at the moment. So, and yeah, as Alex said, we are trying to be really transparent with our people, with our immigrants. And I would actually like to add something in terms of the professionals, is that sometimes we don't want to assume that everybody who is not LGBT proficient, they have prejudices and they just don't want to help the person, just want to turn them away. It's not usually the case. The case is usually that these professionals just don't have enough experience working with this kind of people, working, for example, with trans women, working with non-binary people, and knowing what their triggers are. This is very important to ensure that the person not only has the medical support, but also has an experience that doesn't affect their mental health. Because being an immigrant, being oppressed in their countries is already a lot to experience. So we don't want to add to that.
Absolutely.
So,
yeah. And just to add to what you said, just a little bit before I continue. So sorry for interrupting. Just to add a little bit that the mental health is very important, right? Obviously, we want to stress that a lot, but well, like transparency wise, yes, we want to be transparent. And like Violet said, that definitely, not every single person who's not our proficient LGBTQ professionalist, right, has some prejudice or whatever. But like you said, we have to educate, right? This is the most important thing, is that unfortunately in the United States, doctors have not had 10 years ago, I would assume even less than that, doctors who studied in medical school, they have not had any LGBTQ plus health training. This is crazy as it sounds, right? I mean, it's a more social experience, right? But now it's changing. Like definitely in our organization, we definitely do very intensive trainings for, like this morning, we taught to one of the floors in the cancer center, right? We started their LGBTQ plus training. So like, and we do it simultaneously with other floors, but it's kind of comes in waves, but it depends on our possibility, but we definitely do it very intensively, right? We doing the 6 floors at the cancer at the same time. It's like every day, right? But we want to make sure, and we proactively make sure that they have a questions. We proactively ask them about material, and making sure it's not like, kind of, just, giving out the rainbow sticker flags, right? No, that's absolutely not. I listen, I love representation. The representation and visual representation is awesome. And I would love for everyone to wear a rainbow flag sticker in their ID, like I do. However, by wearing that sticker or having the sticker taped on your ID, that has to come with a training and education. It cannot, it cannot just be representing one community or another without having a knowledge about the community, right? So we need to make sure that, representation also matches the education. That's kind of like, there's a lots of aspects of, going back and the LGBTQ plus health, but that's another very big one that we strive in our organization, is that you don't just represent, you have to be educated and representing at the same time, but you have to know everything, involving treating the LGBTQ plus community before you even wearing a pin or a sticker, So, but representation matters, but also it has to come with education, especially in healthcare. So
I will open the floor to our participants to share their comments and questions. And but I want to ask my last question about mental health, right? So I guess most of it was about physical health, and you mentioned the cancer center, and probably all the providers you work, most of them are physician specialists, not related, but maybe something like if someone experiences a mental health crisis or someone needs a mental health therapist. So what your advice, what are the resources people can use, specifically people who do not speak good English?
So there are some resources available. There's some resources available to immigrants and the people who don't speak a language, who do speak a language. So first of all, we want to assess the situation, right? And the first thing has to be that a patient cannot remain in an emergency situation, right? By emergency situation, I mean something is life-threatening, right? If the mental health condition creates a life-threatening situation, that's definitely an emergency. So the person, no matter what language they speak, no matter what culture they're coming from, no matter where they are, they have to go to the nearest emergency room or call 911, right? Because that could be a sign of the mental health crisis, right? If that's, if the person experiences, life-threatening condition, right? Even from the mental health. So emergency rooms are equipped to provide care for the mental health crises, right? And evaluation. Number 2 thing I will always make sure with the patients is that what do they want to do, right? I always defer to the patient, right? It's another big thing in the healthcare that they have to defer things to the patient, right? You definitely advocate for them. You definitely help them to obtain all information, but you do not make the decision, right? We are patient advocates, but we're not physicians, right? We cannot make a decision for a patient, right? Patient has to make decisions by themselves. So there's the resources available in the language, there are resources available in person, there are resources available via video telehealth visit, right? With a therapist or a psychiatrist, for example, right? Make sure, first of all, again, we go back to insurance, right? As sad as it sounds, is that we have to make sure that the person doesn't end up paying a huge bill for something we need to get a care for, right? There are always resources available. There's always social organizations provide some resources for the mental health. So make sure you reach out to someone who can provide you with this resource, right? In New York, Project Hope, for example, right? It's a big one. They have interpreters. They have, in several different languages, including Russian. So make sure you reach out to someone, right? And get help. I do have a list of some psychiatrists, some psychologists, some organizations which provide mental health services and help. However, as in New York City, as we know, it's not easy to find a mental health professional, as embarrassing as it sounds. But we do have some resources, and I don't want anyone to be discouraged. That there are surely resources, but we want to make sure that you don't experience a life-threatening situation. That's number one goal, and after that we can work with you.
Thank you so much. It's always great to have a contact like you, direct contact, right?
Absolutely.
Yeah, because Violet, I guess you have to deal with a lot of crisis, especially mental health crisis. And it's important for you to build this network, right? So where do you refer people in mental health situations?
If you don't mind, I would like to add something in terms of the previous question.
Sure.
So I have actually learned something from Alex to really ask the question when the person turns to us for the mental health support. I really make sure to understand what the situation is. If it's life-threatening, then I would explain that you do not have to wait. Even if you are uninsured, you do not have to wait. You really have to go to the emergency room or call 911. And in terms of insurance, we'll help you with that. You will deal with that later. We'll provide as much support as possible in this regard. But when it comes to something that is jeopardizing your life, you really have to ask for help and not wait when you have the appointment. And this is something I learned from Alex, and this was really, really helpful. And I see how people feel more supported in this regard. So I kind of assess, when I talk to people, I kind of assess what's the best way to work around the issue right now. Do I have to refer them to the emergency room? Do I have to refer them to the hotline, to the New York hotline for mental crisis? Do I have to call Alex and ask, I don't know, advice in this specific situation? So my job, being the contact person for these people, is to provide as much information as possible to help them.
Definitely. And actually, you mentioned something really, really great, which I didn't mention. It's about the hotlines, right? There's definitely hotlines available for you to call in New York State and New York City and federally. There, we can share with you later. I do have them on the slide. If you can just share with the resources. We're starting with for example, suicide prevention hotline to mental health crisis hotline. For example, COVID related mental health, right? With grief, and especially when the pandemic hit us, a lot of families experienced loss of their loved ones, right? So this is something really, really important, is that there are different resources available for sure. Not maybe in person right away, not life-threatening situation I'm talking about, right? But there are definitely hotlines. There's someone to talk about. There's someone who is there's a hotline which is 24/7, different language. They're gonna get an interpreter. They don't speak your language, but please reach out for help. My main, I feel like the main takeaway from the whole our talk: don't hesitate to reach out for help, because there's always help. And I'm gonna end here.
Yes, thank you so much. So our job, I feel like, is to build trust in the communities in the first place, that you are in New York City, in many places are safe. And sometimes people don't feel safe. Stuff happens every day, even in the city, right? So especially immigrants facing all types of situations every day. But the hospital systems is one of those safe places where you can go and actually reach out, and someone will find you the right care and in your situation, right? So that's our job, is to say, like, don't be afraid of the medical system, right? So go on and ask for help.
Exactly. Never be afraid. Never be afraid, because there's always people to help you in any way possible. And there's always someone who's gonna be taking care of you. You're not alone in anything. And I'm not just talking about healthcare, but as we're keeping it to healthcare only, there is someone to really help you. So there are resources. So please, yeah, reach out for help. We're here for you.
Okay, if you have anything to share, Alex and Violet, you can do it in chat or share on your screen. And we have a few minutes left, actually, so I want to invite our audience to comment or ask questions. We have several people online. If you have specific questions. Alex, I think you have to share with all, not only with hosts, right? With everyone.
I've noticed it tapping in there.
Okay.
Yeah. So I'm going to share my email. And
it's great to know. We'll post your information also when we post this video. So and social workers, so they know, our social workers, social work students know who to talk to if they need to help a client. Right. So anyone from audience wants to comment? I can also stop the recording, so to have a more open conversation. But I want to thank you, Alex, specifically for agreeing to talk to us today, and Violette and RUSA for co-sponsoring this event, so we can celebrate the Pride together. Thank you so much. I will stop recording here, and still we have a few minutes for questions.
Thank you.